7 common habits are quietly causing real physical harm in men over 60, and most have never been explained clearly by any doctor. This isn't about shame, it's about specific avoidable mistakes tied to how aging tissue, medication, and underlying conditions actually work. Today we're reviewing what the evidence says, what's simply outdated assumption, and when a symptom actually needs medical attention. As men age, skin and tissue throughout the body lose elasticity, blood flow patterns shift, and many men take medications that directly affect sensation, blood flow, or bleeding risk. This means habits that caused no issue decades earlier can genuinely cause harm now, not because anything is inherently wrong, but because the underlying physiology has changed. Before going further, a brief note that applies throughout this video: none of the 7 points ahead are about shame or judgment. They're about physical safety, medication awareness, and knowing when a symptom needs medical evaluation rather than being quietly managed alone. If anything here sounds familiar, that's a reason to mention it to a doctor, not a reason for concern on its own. The first mistake is applying excessive force or pressure, often without realizing technique needs adjustment with age. Genital tissue, like skin elsewhere in the body, becomes thinner and more fragile with age due to reduced collagen production and decreased blood flow. Pressure or grip that caused no issue at 30 can cause micro-tearing, irritation, or bruising later in life. Evidence level moderate, based on general dermatological understanding of age-related tissue changes rather than studies specific to this exact context. The practical fix is straightforward. Using a water-based lubricant and adjusting pressure reduces this risk meaningfully. Persistent soreness lasting more than a day or two, or any visible skin breakdown warrants medical evaluation rather than continued self-management. The second mistake, and one of the most consequential, is dismissing pain or discomfort as simply an unavoidable part of getting older. Persistent pain is never something to assume is normal, regardless of age. Discomfort in this area can signal several distinct treatable conditions more common in older men, including prostatitis, inflammation of the prostate gland, or Peyronie's disease, a condition involving fibrous scar tissue that causes curvature and pain, affecting a meaningful percentage of men over 50 according to urological research. Both conditions are treatable, and both are frequently missed simply because men assume pain itself is a normal consequence of age rather than a symptom worth investigating. If something hurts consistently, that's clinically relevant information, not background noise to work around indefinitely. The third mistake involves a connection many older men never think to make: how common prescription medications interact with sensation, blood flow, and bleeding risk in this specific context. Blood pressure medications, certain antidepressants, and medications for enlarged prostate can all affect blood flow and sensation. Blood thinners prescribed to a substantial proportion of men over 60 for cardiovascular protection increase the risk of bruising or minor bleeding from friction that previously caused no issue. This isn't a reason to stop any prescribed medication independently, which can be genuinely dangerous. It's a reason to mention any noticed changes to the prescribing doctor, since dosage adjustments or alternative medications within the same drug class can often resolve the issue without compromising the condition being treated. We're now about halfway through, and this is where the pattern connecting every mistake on this list becomes clearer. Each one traces back to information nobody ever explained plainly, compounded by reluctance to raise the topic even with a doctor. The fourth mistake ties directly into the tissue changes discussed earlier: insufficient lubrication leading to friction-related irritation. Natural lubrication decreases with age due to hormonal shifts, meaning habits requiring no additional lubrication decades ago can now cause genuine irritation or, in more significant cases, small tears. This is one of the most common and most easily prevented sources of minor injury in older men, according to general urological guidance, and it's rarely discussed because most men don't realize their body's baseline has changed. A basic water-based or silicone-based lubricant resolves this in most cases. This is a normal physiological accommodation, not an indulgence requiring embarrassment. The fifth mistake is psychologically driven but has real physical consequences: rushing due to underlying anxiety about maintaining function. This urgency, often rooted in concern that a window of opportunity might close, drives many older men to rush or push through discomfort rather than pausing. Anxiety itself activates the sympathetic nervous system, constricting blood vessels and directly working against the physiological process needed for healthy function. Slowing down and removing time pressure tends to produce better outcomes and reduces the risk of the physical issues described in the earlier points on this list. Before continuing to the next point, if you want a broader framework connecting these physical changes to overall health after 60, Dr. Emily Carter's guide, The Iron Age, the complete blueprint to reclaiming testosterone strength and vitality after 40, covers testosterone strength, energy, and vitality in 9 focused chapters across a concise 14-page format. It's priced at $49.99 with the link provided with this video. It's educational, not a replacement for medical care, but it offers a clear framework for understanding how these physical changes connect to overall health. The sixth mistake carries higher stakes than the previous points, failing to recognize when a change in sensation or function signals an early sign of a more serious underlying condition. Blood present at any point, even in small amounts, should prompt a doctor's visit rather than being dismissed. A sudden significant change in sensation, either decreased or unusually increased sensitivity, can signal nerve-related changes worth investigating, sometimes connected to diabetes, which affects nerve function throughout the body. Difficulty with function, that's new, progressive, or accompanied by symptoms like fatigue or chest discomfort deserves prompt medical attention, since erectile and sexual function are closely tied to cardiovascular health in older men, and difficulty in this area can be an early warning sign of cardiovascular disease, sometimes appearing before other symptoms. The seventh and most significant mistake underlies nearly every other item on this list, never discussing any of this openly with a doctor at all. Many men quietly manage pain, changes in function, or concerning symptoms for years, sometimes decades, because the topic feels too private to raise, even with a physician whose role includes addressing exactly these concerns without judgment. This silence is, by a wide margin, the largest driver of the other six mistakes discussed today. Men who never mention pain don't get it evaluated. Men who never mention medication side effects don't get prescriptions adjusted. Men who never mention changes in sensation miss early signs of treatable conditions. Clinicians who specialize in this area routinely address these exact topics, and raising them directly is far more likely to resolve an issue quickly than continuing to manage it alone. Bringing this together clearly, physical tissue changes with age mean lubrication and reduced pressure genuinely matter, not as an indulgence, but as a normal adjustment. Persistent pain, regardless of cause, warrants evaluation rather than assumption that it's simply aging. Medication interactions are common and usually adjustable once raised with a prescribing doctor. Rushing due to anxiety tends to worsen the exact outcome it's meant to prevent, since anxiety itself interferes with healthy function. And any blood, significant change in sensation, or new difficulty accompanied by other symptoms like fatigue or chest discomfort warrants prompt medical evaluation, not continued self-management. None of these 7 points require an emergency response in most cases, but each one is worth raising directly with a doctor rather than working around indefinitely. It's worth understanding the underlying physiology a bit more thoroughly, since several of the mistakes discussed already trace back to the same root cause: how tissue throughout the body genuinely changes with age, not gradually at a constant rate, but often accelerating somewhat after 60, specifically collagen production, the protein responsible for skin and tissue elasticity, declines steadily from roughly the mid-30s onward, but the rate of decline tends to become more noticeable in the decades after 60, compounded by reduced circulation and slower cellular turnover. This isn't unique to any one area of the body. It's the same underlying process responsible for skin thinning, slower wound healing, and increased bruising that many older adults notice generally. Genital tissue is not exempt from this broader pattern, which is precisely why habits that cause no issue at 40 can genuinely cause micro-tearing or irritation decades later, even when nothing about the specific habit itself has changed. Blood flow patterns shift as well. Vascular changes associated with aging, sometimes accelerated by common conditions like high blood pressure or elevated cholesterol, reduce the efficiency of blood flow to peripheral tissue generally. This has two separate but related consequences worth understanding. First, tissue that receives less robust blood flow tends to be more fragile and slower to heal from minor injury. Second, and directly relevant to several points already discussed, healthy function in this specific area depends heavily on efficient blood flow, meaning the same vascular changes affecting tissue resilience also affect overall function more broadly. Since Peyronie's disease was mentioned earlier as one condition frequently mistaken for normal aging, it's worth explaining this condition in more detail, since it illustrates a broader pattern worth understanding. Peyronie's disease involves the buildup of fibrous scar tissue beneath the skin, typically developing gradually rather than appearing suddenly, which is part of why it's so often missed or dismissed initially. This scar tissue causes the affected area to curve or bend, sometimes accompanied by pain, particularly during specific activities. Research estimates suggest a meaningful percentage of men over 50, and an even higher percentage over 60, show some degree of this condition, though many remain undiagnosed simply because they never mention symptoms to a doctor, often assuming curvature or mild pain is simply a normal variation rather than a distinct treatable condition. The exact cause isn't fully understood in every case, though minor, repeated trauma to the area, sometimes from the kind of excessive pressure or force discussed earlier in this video, is considered a contributing factor in a meaningful subset of cases, alongside genetic predisposition and connective tissue conditions that make some men more susceptible than others, regardless of any specific habit or behavior. Treatment options exist and have improved considerably over recent years, ranging from oral medications and injectable treatments for milder cases to surgical correction for more significant curvature. This is precisely why raising any noticed curvature or associated pain with a doctor matters untreated. The condition can progress and become more difficult to correct, whereas earlier evaluation generally allows for a broader range of less invasive treatment options. Prostatitis, the other condition mentioned earlier, as frequently confused with normal aging, deserves similar depth, since it represents a genuinely common but frequently misunderstood source of discomfort in older men. Prostatitis refers to inflammation of the prostate gland, and it exists in several distinct forms: acute bacterial prostatitis, which develops suddenly and requires prompt antibiotic treatment; chronic bacterial prostatitis, a more persistent recurring bacterial infection; and chronic pelvic pain syndrome, the most common form in older men, which involves persistent discomfort without an identifiable bacterial infection and is thought to involve a combination of factors including inflammation, pelvic floor muscle tension, and nerve sensitivity. Symptoms can include pain or discomfort in the pelvic region, discomfort during urination, and pain in the general area discussed throughout this video, symptoms that overlap enough with what many men assume is simply normal aging. That the underlying condition frequently goes undiagnosed for extended periods. Treatment varies considerably depending on which form is present, ranging from antibiotics for bacterial forms to pelvic floor physical therapy, anti-inflammatory approaches, and other targeted treatments for chronic pelvic pain syndrome specifically. The broader point worth emphasizing here connects directly back to mistake 2 discussed earlier in this video. Persistent discomfort has identifiable, treatable causes far more often than most men assume, and the specific diagnosis matters considerably for determining the right treatment approach, which is only possible once the topic is actually raised with a doctor rather than managed silently. Building further on the medication interaction point raised earlier, it's worth walking through specific medication classes in more detail, since understanding the actual mechanism helps explain why these interactions occur rather than simply presenting them as an unexplained warning. Beta blockers, commonly prescribed for high blood pressure and certain heart conditions, work by blocking the effects of adrenaline on the body. While effective for their intended cardiovascular purpose, this same mechanism can reduce blood flow responsiveness in peripheral tissue, sometimes affecting sensation and function in ways patients don't immediately connect back to their blood pressure medication specifically. Selective serotonin reuptake inhibitors, a common class of antidepressant medication, are well documented in clinical research to affect sensation and function as a known side effect, sometimes reducing sensitivity considerably. This is a well-established, frequently discussed side effect within psychiatric and general medical literature, meaning it's a legitimate topic to raise with a prescribing doctor who may have alternative options within the same medication class carrying a lower likelihood of this particular side effect. Medications for enlarged prostate, particularly a class called alpha blockers, work by relaxing smooth muscle tissue to ease urinary symptoms, but this same relaxation mechanism can affect function in this area as a secondary effect for some men. Anticoagulant medications, commonly called blood thinners, prescribed for a wide range of cardiovascular protective purposes in older adults, directly increase bruising and bleeding risk from any friction or minor trauma, precisely the concern raised earlier regarding excessive pressure and inadequate lubrication. None of this information is meant to discourage anyone from taking necessary doctor-prescribed medication. It's meant to explain why raising any noticed changes with a prescribing doctor is a reasonable, informed step, since in many cases, alternative medications within the same therapeutic class or simple dosage adjustments can meaningfully reduce these effects without compromising treatment of the underlying condition being managed. Diabetes was mentioned briefly earlier in connection with nerve-related sensation changes, and given how common diabetes becomes with age, this connection deserves more thorough explanation. Diabetes affects the body's small blood vessels and nerves over time, a process called diabetic neuropathy and diabetic vascular disease, respectively. This affects tissue throughout the body. But the small, sensitive blood vessels and nerves in this specific area are often affected relatively early in the disease process, sometimes before more commonly recognized symptoms like numbness in the feet become noticeable. This means changes in sensation or function can, in some cases, represent one of the earlier detectable signs of blood sugar issues, making this a genuinely useful piece of information to share with a doctor, particularly for men who haven't had recent blood work checking blood sugar levels. Well-managed diabetes through appropriate medication, diet, and blood sugar monitoring can meaningfully slow or in some cases partially improve these nerve and vascular changes, which is precisely why identifying the connection matters. A symptom dismissed as simply aging, when it actually traces back to undiagnosed or poorly controlled blood sugar, represents a missed opportunity for meaningful intervention on both fronts simultaneously. The connection between function in this area and cardiovascular health, mentioned briefly in Mistake 6, is significant enough to warrant additional explanation, since it represents one of the more clinically important pieces of information in this entire video. The blood vessels involved in healthy function here are notably smaller than the coronary arteries responsible for supplying blood to the heart itself. Because of this size difference, the same disease process responsible for narrowing coronary arteries, atherosclerosis, the gradual buildup of plaque within artery walls, tends to affect these smaller vessels somewhat earlier in the disease process before it becomes severe enough to produce more widely recognized cardiac symptoms like chest pain during exertion. This is why difficulty with function in this area, when it's new or progressively worsening, is sometimes described within urological and cardiology literature as an early warning sign, occasionally appearing a meaningful period of time before a more serious cardiovascular event. This doesn't mean every instance of difficulty indicates underlying heart disease, since many other factors, including some already discussed in this video, medication effects, hormonal changes, psychological factors, contribute as well. But it does mean this particular symptom, when new and persistent, reasonably warrants a broader cardiovascular conversation with a doctor, potentially including blood pressure evaluation, cholesterol testing, and other standard cardiovascular risk assessments, rather than being addressed in isolation. The seventh mistake, staying silent, deserves further exploration regarding its psychological dimension, since the consequences extend meaningfully beyond the physical issues already discussed throughout this video. Carrying an unaddressed physical concern silently for an extended period, whether that concern involves pain, changes in function, or general anxiety about what might be happening physically, creates a genuine psychological burden that compounds over time. Men who quietly manage a concern for months or years without raising it often develop secondary anxiety specifically centered around the original issue, sometimes avoiding related situations entirely, which can create a pattern where the psychological response eventually becomes intertwined with and sometimes more limiting than the original physical concern itself. This compounding pattern is precisely why addressing concerns early tends to produce better outcomes than addressing them after years of silent accommodation. A straightforward physical issue addressed early generally resolves more simply than the same issue addressed years later, after anxiety and avoidance patterns have had considerable time to develop and become established in their own right. For men who've never actually raised any of these topics with a doctor, it's worth demystifying what that conversation typically looks like, since anticipation of an uncomfortable conversation is often considerably worse than the reality most patients describe afterward. A thorough physician will generally ask direct clinical questions aimed at understanding symptoms accurately, timing, severity, any associated factors, rather than out of any judgmental curiosity. This is a routine part of general and urological medical practice, not an unusual or uncommon topic for a physician to address. In most cases, the conversation itself takes only a few minutes, followed by a clear plan, whether that involves a simple recommendation, a medication review, or further testing if warranted based on the specific symptoms described. Basic evaluation for concerns discussed throughout this video often includes routine blood work, checking testosterone levels, blood sugar, and general cardiovascular markers, alongside a physical examination when clinically appropriate. None of this requires any dramatic or invasive initial step, and most concerns raised at this stage can be addressed through straightforward, well-established approaches once properly identified. It's worth offering a simple, practical framework for evaluating whether any of the 7 mistakes discussed throughout this video might apply to your own situation, rather than leaving this entirely abstract. Consider whether you've experienced any persistent discomfort in the past several months that you've quietly worked around rather than addressed directly. Consider whether a new medication has coincided with any noticed change in sensation or function that you haven't yet mentioned to the prescribing doctor. Consider whether you're using adequate lubrication, or whether you've simply grown accustomed to friction or irritation that wasn't present at a younger age. Consider whether anxiety or rushing has become a consistent pattern rather than an occasional occurrence. And consider, honestly, whether there's anything from this list you've been meaning to mention to your doctor but haven't yet found the right moment to bring up. None of these questions require an emergency response if the answer gives you pause. They simply indicate where a conversation with your doctor might reasonably begin at your next appointment. It's worth briefly addressing why this specific topic carries so much more silence and stigma for men in this age group specifically, compared to younger men navigating similar concerns. Many men currently over 60 grew up during a period when this topic wasn't simply private, but was treated as something almost inappropriate to discuss even in a clinical setting. A cultural pattern that doesn't automatically dissolve simply because medical understanding and openness around the topic have genuinely improved considerably in more recent decades. This generational conditioning often compounds with an additional layer of self-consciousness, an unspoken sense that this topic feels somehow less appropriate to raise at an older age than it might for a younger man, as though there's an implicit expiration date on when these concerns are considered legitimate to bring to a doctor. Clinically, no such expiration date exists. A concern raised at 70 deserves exactly the same thorough, non-judgmental clinical attention as the same concern raised at 30, and understanding that generational conditioning exists without needing to personally overcome it entirely can still make the decision to finally raise a long-standing concern feel somewhat more approachable. Given everything discussed throughout this video, it's worth ending with something genuinely actionable rather than leaving this purely informational. If any of the 7 mistakes discussed today felt familiar, preparing a few specific notes before your next doctor's visit tends to make that conversation considerably more productive than trying to explain everything from memory in the moment. Jot down roughly when a symptom started, whether it's been constant or intermittent, and whether it coincided with any change in medication, since this timeline detail often matters considerably for narrowing down a likely cause. Bring a current list of every medication you're taking, including over-the-counter supplements, since interactions aren't always obvious even to the prescribing doctor without a complete picture. And if you've noticed a pattern connecting a symptom to specific activities, positions, or times of day, mentioning that detail specifically can meaningfully speed up an accurate diagnosis. A vague description, something like "things have felt different lately," gives a physician relatively little to work with initially, often requiring several follow-up questions just to establish a basic timeline and pattern. A specific, prepared description, by contrast, allows a doctor to move more efficiently toward appropriate testing or treatment recommendations, rather than spending the majority of a limited appointment simply gathering basic background information that could have been prepared in advance. This preparation isn't about being overly clinical or turning a normal doctor's visit into an elaborate presentation. It's a practical way to make sure a topic that already feels difficult to raise gets addressed as efficiently and productively as possible, once you've taken the harder step of actually bringing it up. One last point worth emphasizing. There's no ideal or required moment to finally raise any of these topics with a doctor, and waiting for some perfect opportunity often simply means waiting indefinitely. Your next scheduled appointment, whatever its primary purpose happens to be, is a reasonable moment to mention any of the 7 points discussed today, even briefly, even if it feels like a minor addition to an otherwise unrelated visit. Physicians are generally well accustomed to patients raising an additional concern toward the end of an appointment, and doing so costs very little while potentially saving considerable unnecessary discomfort or delay in addressing something genuinely treatable. So here's the bottom line. None of these 7 mistakes reflect anything wrong with you specifically. They reflect information nobody clearly explained, combined with a cultural reluctance to discuss this topic openly, even with the one person whose job is to help without judgment. 3 practical takeaways. Use adequate lubrication and moderate pressure as a normal accommodation for aging tissue. Treat any persistent pain or unusual bleeding as information worth sharing with your doctor rather than something to quietly manage. And remember that raising this topic directly with a physician is far more likely to resolve an issue than continuing to navigate it alone. If anything discussed today sounds familiar, that's worth mentioning at your next appointment. The Iron Age Guide is linked with this video. Thanks for watching, and I'll see you in the next one.